Now, to use this one for infants, to use these evohalers for the infants or the preschool kids or school kids, we need to use them along with the spacer devices. Spacer devices, in front of you, we have generally large size spacer devices. This is one which is volumatic. This is another which is used Biclomet for the specific medicines, and this is also baby inhaler for another for most of the inhalers. These are large size spacer devices which are 750 ml, and these are smaller spacer devices like aero chambers. These are with the big mask, and this is for the infants, and this is without the mask. And we have so many types of these spacer devices. The smaller types being used still in the market. In the past, we were using initially like this one extension tube, so that we were putting the inhaler and putting this in the mouth and directly we're taking it. Nowadays, we don't use these ones. This was in the 60s and 70s. And then later on, it comes with these smaller devices, spacer devices, which are 100 ml, which we put our canisters inside and push one, and then we take this one in our mouth and breathe in. And nowadays, these are also not used because we have better devices, like either large size spacer, which is more potent in getting more medicines into our lungs than the smaller ones. But in the interim also we had these like inhalers where we put our canister inside, and it was when we push it will go inside there, and we were breathing in. We open it this, and then we have, but nowadays we don't use it because these are not really as good as the small with a 170 or 175 ml spacer device or larger spacer devices. So no, I'm going to explain to you mostly on the smaller, which is commonly used in the market. What we are going to do, we are going to take this one for the older kids. 2-3 years of age, we can use it very simply. What we are going to do, first of all, as I said earlier, we need to recap, put the cap off and shake it 2-3 times, and put this one on the only hole in the spacer device and put it upside down, so that when we push, it will have also enough medicine coming inside there. Now, these also, we need to put it on the face of the baby, on the nose and the mouth tightly. And when we push, we make the patient breathe 6 times. Maximum, we are talking to the kids and the parents, up to 10 breaths. Sometimes the mother cannot count properly, so we let them count up to 30 seconds. Now, these spacer devices are advantageous in 2 things. It has inspiratory valve and expiratory valves. Some of the older ones, cheaper qualities, they don't have many valves. They have only 1 valve, exhalation, and the installation is there. So these are 2 exhalation valves, inhalation and expiratory valve, which where the mother or the parents can see the breath of the baby, and it has to be sealed nicely on the face of the baby. Okay, now we have currently in the market 2 types of these also. There are the one where we say anti-static, and the normal one. Anti-static means that what? When we push the medicine, very little medicine will stick into the inner lining of the spacer device. This is very advantageous, so that more medicine it will go to the lung of the baby.